Study Session 10: Stages of Illness and Their Significance in Medical Social Work. Introduction. In this study session, you will learn about stages of illness and their significance in medical social work. Illness occurs in stages, namely, the stage of transition from health to illness, the stage of accepted illness, and the stage of transition from illness to wellness. Each of these stages has useful implications or significance to the sick individuals, their families, and the health caregivers or social workers. What then are those things that constitute the different stages of medical social work? Learning outcomes. When you have studied this session, you should be able to identify the stages of illness, state the first function of the social worker in the stage of transition from health to illness, identify the last function of the social worker in the stage of accepted illness, and state the main functions of the social worker in the stage of transition from illness to wellness. Stages of illness. Illness exists in different stages. According to Lederer, 1952, there are 3 stages in the social experience of illness. These are 1. Transition from health to illness, 2. Stage of accepted illness, and 3. Transition from illness to wellness, or convalescence or recovery stage. 1. Transition from health to illness. This is the first stage of illness. It is characterized by illness behavior, which is the behavior an individual engages in when he or she feels ill. For instance, the individual may do nothing about the illness, engage in self-medication, consult quack doctors, and so forth. It should be noted here that if the sick person, after recognizing the symptoms of his or her illness, example, headache, pains, etc., and reports them quickly to a competent doctor in the hospital, he or she will receive prompt medical treatment and overcome his illness on time. Mojonyola, 2002. On the other hand, if he or she delays too much in reporting such symptoms early, his or her illness may become worsened and immediate cure and recovery may be difficult to achieve. 2. Stage of accepted illness. This is the second stage of illness. It is a stage where the sick person is seen by the doctor who made diagnosis and prescribed treatment for his or her ailment. It is the stage the sick individual is expected to perform specific role called the sick role. The sick role may be medical or psychiatric role. A. Medical sick role, Parsonian model. The medical sick role model was conceptualized by Tackett Parsons, 1951. According to this model, the sick individual assumes the following roles during illness. He is not held responsible for his incapacity. He is released from varying degrees of normal role obligation. He must recognize that illness is undesirable and have expressed desire to get well. He must relinquish the right to make decisions to the physician and other healthcare professionals. The medical sick role is applicable only to acute physical illness. Hence, it does not apply to chronic physical illness and permanent physical disability. B. Psychiatric sick role. When a condition or illness has psychological connotations, the question of personal responsibilities arises. Hence, the mentally ill individual's role are different from the roles of the physically or medically ill patients. In other words, on the parameters of helplessness, passivity, submission, and dependency, the psychiatric sick role tends to be in opposition to the medical sick role. The psychiatric patient is generally expected to be active, independent, and self-directed in interacting with health caregivers, that is, doctors, nurses, social workers, etc. The psychiatric patient is expected to 1. Take care of him or herself, that is, bathe, go to the toilet, etc. 2. Tidy up his or her bed and lockers. 3. Go to the table and eat by him or herself. 4. Go out for group work, group therapy, and occupational therapy. 5. Go out for games, sports, and other recreations. And 6. Participate in other word activities, and so on. By performing these roles, the mentally ill patients can be assessed whether there is an improvement in their conditions or not. 3. Transition from illness to wellness. This is the third stage of illness. It is the stage of convalescence, recovery, or rehabilitation. The stage involves a change from sick role to well role. At this stage, the sick individual is expected to assume well roles, which among others include the following. 1. Attempt to relinquish the sick role, and 2. Physical and emotional readiness to resume well roles. Example, willing to get out of bed, walking around the ward, bathing him or herself, etc. It should be noted here that patients who wish to resume their well roles earlier than is medically advisable are common, possibly because of an earlier essential discomfort with dependency. On the other hand, patients who do not wish to resume their well roles when they are medically considered capable of doing so are probably overcomfortable with the dependency legitimated by illness, or they are much satisfied with the secondary gains they receive from the sick role. Example, attention, gifts, money, and other material gains. Functions of the social worker at each stage of illness. The 3 stages of illness discussed above are very important in caring for or helping the patients to get over their illness as quickly as possible. Each stage of illness also has useful implications for medical social workers. The significance or implications of each stage are discussed below. 1. Stage of health to illness. At this stage, the medical social worker has to perform the following professional functions. 1. Helping the sick person to recognize symptoms of his or her illness. 2. Encouraging the sick persons to report symptoms of illness early in hospitals. 3. Allaying the fears and anxiety that accompany symptoms of illness. 4. Helping the patients to cope with feelings of shame, guilt, or disgust. 5. Encouraging the patient to have faith, trust, and confidence in the helping people. Example, social workers, nurses, doctors, relatives, etc. that care for him or her, and in the treatment or care they give to him or her. And 6. Disseminating accurate information regarding health and illness to public audiences, thereby helping to make the transition phase less ambiguous. 2. The stage of accepted illness. At this stage, the primary functions of the medical social workers are 1. Gathering information regarding patients' internal or external environment. 2. Modifying the external environment until the patient is able to adapt to it. 3. Helping the patient to accept the fact that he or she is ill. 4. Helping the patient to accept his or her illness. 5. Allowing the patient some degree of dependency. 6. Assessing the coping abilities of the patients. 7. Reinforcing motivation to get well. 3. The stage of transition from illness to wellness. The responsibilities of the medical social workers at this stage include 1. Moving the patient to a maximally independent level of functioning. 2. Reinforcing the patient's incentive to get well and decreasing the secondary gain from the illness. And 3. Preventing patients from having residual disturbances in psychosomatic adjustment due to unresolved conflicts or feelings. Study session summary. In this study session, you learnt that there are 3 stages of illness. The responsibilities or functions of medical social workers were also spelled out in this study session. End of study session 10. Thanks for listening.